Yeah, so my son was diagnosed with autism when he was about 3.5. It was about a long process really to get him diagnosed. So we knew well beforehand that he was autistic, but he finally got his official diagnosis when he was about 3.5, and it was for moderate autism. Yeah, so I think scary. It was kind of scary, just the unknown of the future and, what was his life going to be like when he grows up, and all the unknowns was very scary for us. Um, but then also just and the day to day was difficult because you have so many obstacles, having to deal with a child that's very resistant to change and very rigid in his routines, meant that even his dad, for example, couldn't drop him off at school in the morning because it had to be mom and in mom's car. So just little things like that just obviously adds more difficulty to the situation too when you're dealing with, that type of rigidness and inflexibility in your life. Yeah, for us, it was always communication, or in other words, lack of communication, really. Just the fact that, our son was 3, going on 4 years old, and still couldn't say more than a couple words at a time. So it was really hard just to understand what he needed a lot of times. And that's really difficult when, you have to just kind of guess about what your child needs and they can't just tell you. So that was really hard for us. That was something that we were struggling with, you know, every day, and we're really frustrated because nothing we were doing was working to help him. We were doing therapies, speech therapy, ABA therapy, occupational therapy all the time. He was in a daycare full time with other neurotypical kids, and we were just not seeing any improvement whatsoever. So that was probably our biggest struggle. My first experience was great. It was virtual because I'm in Charlotte, North Carolina, so we've done it all virtually. But just spending that, I want to say an hour, I guess, on the phone talking about her experience with, her kids, and just really getting to know her and why she's passionate about what she does, and then hearing some of the success stories that she's had, was just do as well about, my own struggles, from someone who actually can relate. So yeah, it was very good. I really enjoyed that first meeting. Yes, I think there's lots of little moments. Dr. Davis is always super open to just hearing about what's going on that week. What is the specific struggles that we're going through right then in that moment. So it was nice to have someone that I could just come to and say, hey, we're having a really hard time with getting dressed in the mornings, any advice, that kind of thing. She was always open to giving advice. But then there was also one specific moment that was 2 weeks ago, that I told her about some really positive feedback that we got from his school. And she was so excited and so happy. And just knowing that she really like cares. And I could tell that like this was something that she was really, happy about, that when she gets good news about her patients, it really makes her excited. So it's definitely a lot of small changes that happen over time. That's not a whole lot of big overnight aha moments. So sometimes it's hard to see how much progress you're making throughout this time. But one thing that, Dr. Davis does that I like a lot is we do regular check-ins with the ATEC score, so we can kind of have a baseline of where he started with these specific list of questions. And then periodically you can go back and revisit those questions and see if things are progressing. So every time we would do that, and you could see that score improving. And as you're answering the question, you can see, items that he used to not do, but now he does. And so every time we would do that, it was always a moment of like, wow, we're really accomplishing something here. We're really making progress, and it's hard to see, the day-to-day changes, but the month-to-month changes are huge. So like I said, we've done everything virtually. I don't live in the Raleigh area, so we've always done Zoom calls, but we're always, meeting with video on so we can see face to face. It's been really convenient too. I don't have to leave my home. I can do everything from my office. So we typically meet during the week when I'm working. So it's really nice. I can just hop off of my work for 30 minutes, quickly jump on a Zoom call and get that done. So, I feel like we're not missing any of that contact. And at the same time, we're still able to, you know, meet as much as I think we should. And yeah, it'd be nice if we could do it in person, but that's fine. Yes. So she's great about explaining the reasoning behind every choice that we've made, every change that we've made, everything we do, we definitely discuss thoroughly. She wants to make sure I understand why we're doing it, what's the benefit. And then she's also really open to feedback from me about when we do try something different, like if we start a new supplement or a new vitamin, she really wants to know how it's going and how it's affecting him, and if there are any other changes that need to get made to the decisions that we're making. So yeah, like I said earlier, communication was a big struggle for us. And a year ago, my son couldn't even put, a 4-word sentence together. In fact, he didn't say anything in sentences. He would just use words to try to, singular words to try to communicate with us. And it was very simple. So over time, over this last year, he, started to put 3-word sentences together. And then that was a big improvement. We were super excited about it. And then he started asking questions, which was amazing because he had never asked a question before in his life. And then he started trying to not only ask for things or ask questions, he started to ask questions to share things with us. Like just last week, we were in the car and he pointed out his window and he said, "Is that an airplane?" So he was not only asking me a question and talking in a full sentence, he was actually trying to share something with me and get my attention and, not just because he needed something. So it's been amazing to watch how he's been opening up and we can start to get more and more glimpses into what's going on in his head. He's wanting to share more with us. He's wanting to play more with other kids now that he has that ability to talk to them. So that's been amazing. I think that so I meet with her every week. We talk every week on the phone for 30 minutes. And like I said, we're very detailed in our discussion. Sometimes it's specifically just about what's going on in his life and how his behavior is and what we're struggling with or what we're doing well on. Other times we're talking about his medication or his supplements. So it's very thorough and, like I said, very frequent, which I enjoy. I like having that regular touch base. So I just think the fact that she takes her time out of her week every week to talk to me and about my son is in itself above and beyond what I would expect from a doctor. I would say, and I do say to other parents that I know who have children with autism, that this was the best decision we've done in his treatment for autism. We have done, lots of therapies. We have considered putting him in special needs schools. We have done so many things, but out of all of the things we have tried, this has been by far what we think is the most successful in helping him improve his symptoms. So I tell everyone that I meet who is somehow connected to the autism community that I would recommend this type of program. So absolutely, if you're on the fence about it, please do it. It's a commitment. It's definitely a commitment, but it's so worth it. Great. Thank you so much
Okay.
to you.